Now to herd immunity. Some doctors and some in the Trump administration see it as a strategy to ending the pandemic.
But as CBS2’s Dr. Max Gomez tells us, the human toll would be massive.
Herd immunity means if enough people get sick and recover from an infectious disease, their immunity will keep the virus from infecting others. But you need huge numbers of people to get sick to achieve that. Estimates for coronavirus range from 60 to 80% of the population. And right now, only about 8% of the U.S. has been infected. Herd immunity has never been achieved without a vaccine. And even with a COVID vaccine, it's not clear how strong or how long immunity will last. There have already been a few cases of people getting COVID twice. So if we let the virus spread unchecked throughout the population, it would be virtually impossible to isolate high risk from lower risk individuals. The human toll would be immense.
A lot of people who do not die still have very serious illness and end up in the hospital and need intensive care. And it would overwhelm already pretty stretched hospitals.
The death toll would be just as devastating. Using the latest numbers from Johns Hopkins of more than 8 million COVID cases and nearly 220,000 deaths, the death rate is over 2.5%. Even if we only need 60% of the population to achieve herd immunity, that would still mean more than 5 million deaths from COVID-19. Dr. Grunwald says that improved medical care, drugs, and a possible vaccine would lower the death rate. But even the most conservative estimates are that a herd immunity strategy would mean at least another 500,000 dead Americans, most of which would likely come from minority communities and the elderly. Dr. Max Gomez, CBS 2 News.